Good morning, Miss Menimol.
Good morning.
Okay, I'm Anureka, one of the registered nurses in this hospital. I'm going to take care of you today. How are you today?
Sister, I'm not well because I want to go home. I want a discharge because the condition is not good and I couldn't get enough sleep or rest. So it is better to go home.
Okay, Miss Menimol, I'm uh, uh, sorry to hear you. Uh, Before that, would you mind telling me what's bothering you here in hospital?
Sister, this ward is very busy and I'm not able to drink or sleep. I have
Mm-hmm.
so many problems because of this noise, I couldn't sleep well yesterday night. So it
Okay,
is better to
I'm
go home. That is the best way, I think.
Yes, I perfectly understand your concern, Miss Menimol. Before that, have you taken your breakfast today?
No, sister.
Mm-hmm. Okay, I gone through your case note, and doctor mentioned that you have a severe kidney problem due to bacterial infections. Do you know that?
Yes, sister. I can understand the condition, but it is better to go home and I will come back if any condition that gets worse.
Okay, don't worry, Miss Minimal. I'm here to help you, and don't need to worry too much. Okay, it seems you are too much panic and anxious. Be relaxed, stay calm. Okay, we are here to help you, and we will taking care of everything. Okay. Before that, I want to check your temperature again. Can you allow me to do that?
Okay, sister.
Okay. Okay, Miss Minimal. I checked your temperature. It's still high. Okay. Do you feel any body pain, any other symptoms?
Sister, I'm totally upset and I have pain. Everything is there. I have vomiting. So, but
Uh,
I'm still worried.
okay. Relax. Okay, I'm here to help you. Before I want to explain you something, we are giving you the intravenous antibiotic injections for your condition because this kidney is infected. So it's highly recommended to treat with intravenous antibiotics. Do you understand what I'm saying?
Yes, sister.
Okay, if you go home without taking these antibiotics injections and proper treatment, it will cause other complications like damaging to your kidney, and it will be very risk for you. Can you follow me?
Yes, sister. But in this confused patients are there in this ward, and I couldn't get privacy for anything. So could you please arrange a private room for me? It's better.
Okay, that's understandable concern from your side. I can perfectly understand what you are feeling now and how must be feeling. Okay, uh, so I'm really sorry that for this disturbance and everything. I would recommend you that to shift other ward. It's a really a good idea. I will also talk to a doctor and other ward managers to shift you as soon as possible. Okay. Before that, I want to explain you some complication which are going to be happen if you go home soon. Can you follow me?
Sister.
Okay. What you want me to recommend? If you go home, what will you do?
Sister, I don't know what to do, but the if you arrange me a separate room, that is okay. Uh, it will be better to stay here. I'm happy to
Okay.
hear that.
I really appreciate your decision, and it will be very helpful for your current conditions to improve your health status. And don't worry, be relaxed. We are anytime available to help you. Okay.
Sounds good, sister.
I will arrange you another word as soon as possible, and I will discuss the doctor about your concern. Is it okay, Manimu?
Oh, yes, sister. Thank you.
Okay, don't worry. Stay calm. I will be back soon. Okay. Thank you.
All right. Okay, Anu. Firstly, let me give you the first thing. You were able to complete all the bullet points of the role play conversation very well. Okay, I'm very happy with that. So that's a good thing. All right. Well on time. So that's the first thing you have done very well. Okay. All right. The second thing is you were able to introduce yourself very well as well.
Positive.
All right. So these things are good enough. Okay. There are a couple of issues. Okay. Let me give you this. I want, would you mind? Okay. So when you had to ask questions to the patient, you have made a mistake. Okay. So this is a grammatical mistakes. Okay. So you shouldn't give any false start. False start needs to be avoided for sure. So please do not give any false start. Okay. It's not good. All right. That is an issue. And then you said, I am sorry. But when you have said this, okay, you took long hesitation. You remember when you listen to the audio file once again, you will be able to get to know. So it was in the introduction part. So you took long hesitation to speak. Okay, that's not good. And you said, I gone through. So I gone through. That's wrong. It's actually I have gone through. I have gone through. Okay, that should be the correct one. You were able to confirm the understanding of the patient very well. So I'm very happy of the information by the patient. Okay, so you are able to confirm it in a polite manner. So that's good. All right, so that's a good thing. So you have done a good job in this case. I'm happy with that. Okay, let's go to the next one. All right, you said details with the doctor, with the patient, and then you said too much panic. Okay, you shouldn't be too much panic. Too much panic. Too much panic. Too much panic and okay, too much panic.
السودان حقي
دكتور
السودان حقنا حق عرب السودان.
Okay, please mute your microphone if there is any issue. Okay, it's too much. You seem to be too much panic and anxious. Okay, anxious is all right, that's fine, but panic is wrong. You should have mentioned too much panicked. It's not panic. All right, so you should say panicked and anxious. Okay, so that's the correct way of telling the sentence. All right, and then you said, can you allow me? Can you allow me to? And then you said to do that. Okay, can you allow me to do that? Okay, this is wrong. This is not good. You should use the polite phrases. For example, could you let me? Could you please allow me to do that? Otherwise, you can say, may I do that? Or something like that. Or you can say even, can you please allow me to do that? So that those phrases could have been more formal. All right. You have repeated okay several times. So this phrase was repeated several times unnecessarily. In some occasions it is okay, but in many instances it wasn't properly used. So this phrase was repeated several times unnecessarily. All right, so that's not good. You could have rectified the mistake. Okay, and then you have committed some background noises. You have said So background noises could have been reduced or avoided. If you cannot completely avoid, try to reduce as much as you can. All right. You were able to make the patient understand your information. It is really good. I'm very happy with that. So in under the sharing information with the patient, you were able to score really very well. Okay. That is one of the assessment criteria anyway. So the next thing is, it will be very risk for you. Okay. It will be very risk for you. Okay. So I will tell you what mistake here it is. Okay. So you should say it will be very risky for you. Why? What's the difference between risk and risky? Okay. Risk is what? Risk is going to be the noun. Okay. But you should have used an adjective here, in order to tell that it will be risky for you. Okay. Otherwise, what you could have done is you could have mentioned it will be a very risk for you. All right. It should be or it should be, risky. All right. Either you should use an adjective or an article before that so that it can be the appropriate sentence. Okay. All right. Let me go to the next one. You have committed one mistake which you have done in the past as well. So you said that's understandable concern. Okay. So you should have mentioned that is an understandable concern. Okay, that's an understandable concern, or that is understandable. Okay, or you can say that is, or that's understandable. Okay, what else? You have repeated before that several times. This phrase was repeated many times, but most of the times, luckily, the way you have used them was appropriate most of the times. Okay. So most of the times it was used appropriately. It was used correctly. All right. Just just a recommendation for you to use a few other words. You can say, "Can I do this first, and then I will do that." Okay, instead of saying before that. Okay. All right. That could be much better. Don't say, "Can you follow me?" One of the major issues with your role play conversation is that you have been using too many informal phrases. It's not good. Please say, could you or are you able to follow me? So use these things. Okay. Are you able to follow me? All right. Or is that clear? Is that clear? Is that clear? Okay. Or so on. All right. There is another one. So when you were able to give an opportunity for the student, sorry, for the interlocutor. I've been always thinking about students. It's the interlocutor. All right. So you were able to give an opportunity for the interlocutor to raise their suggestions and comments. Okay. So it's good. It's a very good thing. I'm happy with that. All right. Good job. So you asked her, what did you ask? Okay. If you go home, what you will do? All right. So that's a good thing. And the other good thing is you were able to establish good rapport with the patient by appreciating her. So that's a good thing. I'm very happy with it. So there are many areas, where you were able to perform much better than before. Okay. So the next one is discuss the doctor about. Okay. This is wrong. You should have said, I'll discuss with the doctor. And then you can say, and whatever the things, you shouldn't use about. You should only use, I'll discuss with the doctor further treatments or further options or further medications or something. There should be a noun only after that. But apart from these things, it was all right. Your pronunciation could have been a bit better, because could have been a bit better. because of the background noises and long hesitations. I think you have committed one long hesitation in between, and then in a couple of instances you have created some background noises, but it is okay. At least you are able to reduce the frequency of those hesitations and long-term passes. So I'm happy with that. So that's a very good thing. All right. And what else? Grammar could have been much better. Okay, grammar could have been much better. All right, you could have improved it a lot. Vocabulary is another area. Vocabulary is another area of concern. Okay, remember that although it is a semi-formal conversation, using as many formal phrases as possible can help you out a lot. Okay, because the patient is agitated, isn't it? She is in the emergency ward, or so she's not feeling comfortable. So it is much better to speak with the patient using polite phrases. You also need to consider the situation where it is happening, where the conversation is happening. If the patient is very angry, if the patient is very agitated, is not comfortable, it is better to use more polite phrases rather than the impolite phrases. Okay, vocabulary is another area of concern, as you have used so many informal phrases. It's not good. It's not good. You need to use as many formal phrases as possible. You could have also used more connecting phrases. That is another area. Okay. So apart from this, you have done a wonderful job in this role play conversation. Okay. So let me go through the mistakes first, and then I'll give you the feedback on your scores. Okay. So the first one is, okay, these things are good. All right, so there are a couple of grammatical mistakes and then some of the background noises. Okay, so looking at the number of mistakes and the frequency, all right, this one is definitely better than what you have done in the past. All right, but taking into the account of vocabulary, the informal words and background noises and pauses and so on. See, I'm not fully confident to give you a 350 out of 500 score, but this one can definitely get you at least 340 out of 500. Okay.
Okay, tomorrow I will get 350.
Of course, yeah. So it is a very good jump. You got, I think in the last role play conversation, I think you got only 270 or 280, isn't it? Or 290. I don't know.
Yes, then 320. Then
yeah, 320. Yeah, okay, good. Now it is 340, so it's good. So there are a couple of areas you have to focus on. You have to use formal words as much as you can, especially with the patients who are agitated, all right, who are not comfortable, who are angry, who are going to raise some kinds of concerns. Okay, with them you need to be a bit mindful about your language. All right, apart from that, it's good. It was a very decent performance. If you could have rectified at least a few issues with your vocabulary, and then if you could have rectified maybe some of the grammatical mistakes, some of the grammatical mistakes, I think this one definitely would be able to get 350. Okay.
okay.
All right. I'm very happy that you have been able to improve your score dramatically. It's a good thing.
Yes, I have gone through your all phrases and last night, and tips, the strategies, everything.
Yeah, good.
Then I can do this.
Sounds good. I think maybe in the next role play conversation you must be able to pass.
380 I will get.
Let's be positive. Okay.